I will ask you. All right, here. All right, so if you've read and understood, considering it clinical examination station, please begin.
Good evening. My name is Dr. Vijay. May I know your name and age, please?
Yes, Tom, 56 years old.
Good evening, Pam. So today I've been asked to examine your tummy. So is that okay with you?
Okay, but I'm in too much pain.
Okay, I understand that. I'm really sorry to hear that as well. So I see that you have underwent surgery few days back.
Yes.
Yes. So exactly 6 days ago, you underwent left hemicolectomy. Is that correct, Mrs. Palmer?
Yes, Mr. Tom.
Yeah.
It's not an
So,
issue taking, so it's examination. So we
okay,
can't ask too many
okay,
questions.
okay. So, do you wish to have a chaperone as I do my examination?
It's a male patient, and it's not, you don't need a chaperone for this one.
Okay, okay. So, I'll expose from just below the chest to slightly above the like slightly below the inguinal region. I'll also plan to examine the private part maybe later. So first I'll do the inspection.
So, but
So
please tell us loudly, what exactly are you looking at in inspection?
so in uh, inspection, I'm looking at the shape of the abdomen. What is the a normal movement? Whether how the movement is with respiration. Since he's already post-op patient, I'll also look at the stoma bag and scar if any present, and any skin changes, erythema. I'll look for that, and I'll also do a general physical examination, like look at his arms and trunks, any pallor, cyanosis, like that. So should I go ahead, ma'am, or
Yeah,
is there
continue,
anything?
continue. Yes, you continue, please.
So then, after general inspection, I will palpate the abdomen in all the 9 quadrants, starting from the right iliac fossa
Okay.
and going to the left iliac fossa in the last.
Okay.
So
Now patient is screaming, ah, you have hurt me, doctor.
so I'll try to comfort him.
How?
I'll if it is really painful, I'll try to comfort him, and I'll go to the tender area, the last.
Yeah, but you have reached at last and patient has screamed, ah, you've caused me pain, doctor. This is too
Oh, I'm
much.
really sorry. I'm really sorry for that,
Yes.
and I'll just remove my hand.
Yes. And what would you do next?
Next, after that, I'll palpate the liver.
No, 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 no. What would you do next? You did superficial palpation
I'll
from
do
begin.
the
Yes.
deep palpation.
No, you'll not do the deep palpation.
Hernia orifices.
No. You'll
Uh,
say, okay, patient is in too much pain. I cannot
okay.
continue
Okay.
this abdominal examination. I'll rather go for Ccrisp protocol. Then what would you do? Please. 2 minutes are left.
Crisp protocol, I'll observe for
Airway.
yeah, A, B, C, D, E.
Yes.
Airway,
Airway.
breathing, circulation. Airway, I look for the respiration, how the respiration is like thoraco-abdominal or normal
Okay.
diaphragmatic breathing. Then
What would you check in breathing exactly? Mouth for cyanosis and
mouth for cyanosis, normal inspiratory expiratory movement, whether it is a
yeah.
paradoxical or not, like normal or paradoxical. And
If
then I'll check
trachea
for
is
circle.
central or not,
Yeah, trachea is central or not, and
then
uh, uh, movement of whether both the side of the chest, lung movements.
you said that. Next,
Pardon? And
you said that. And then percussion. Would you percuss the chest only from the front or the back as well in abdominal examination of Crisp protocol?
from the back as well.
No,
Okay.
just the front. And then what else? You'll auscultate the chest as well. And
Yeah.
you'll move on to the circulation. You still have 37 seconds.
So circulation part, I look for cyanosis. I look for the extremities, whether they're cool, clammy, and whether cyanosis is present or absent. Then
Mouth for dehydration, eye for pallor, neck veins for engorgement, and then you'll auscultate the heart. Then you'll move on to the D, disability.
disability.
What would you
Yeah.
do in the disability?
Mhm,
Okay. Then the last is exposure. What would you do? You will offer,
so
because there is a patient has a dressing, and you'll offer to expose the wound dressing and squeeze the calf muscle for tenderness if you expect. And examiner will say consider, then you'll stop. All
okay.
right. Now bell has gone. Kindly summarize your examination.
Okay, so I have today examined a 56-year-old male who is
Yes,
sixth post-op day after left hemicolectomy,
yes.
and on palpation, on
Oh,
superficial
wait. General inspection, what did you see?
on general inspection, there was a stoma bag and a scar on the left side, and stoma bag. And movement of the abdomen was normal, thoraco-abdominal. There was no erythema or any other skin changes. Uh, and breathing was also normal. So
So
on
there was shortness of breath and there was generalized abdominal pain, right? And
and
then what happened on superficial palpation?
on superficial palpation, there was tenderness in the left iliac fossa
Yes,
that necessitated me to go for Crisp protocol of
very good.
ABCDE.
Very good. Then what was
So
your finding on Crisp protocol?
on Crisp protocol, the airways, the trachea was central, and breathing was thoraco-abdominal. There was symmetric movement of both the
Very
chest.
good. And there was no cyanosis
No
or pallor.
cyanosis
Yes.
or pallor.
Percussion was
Uh,
normal.
percussion from the front is normal. Uh,
No
circulation,
no congested neck veins and
no congested neck veins. Slightly cool and clammy. It's normal. No extremities were normal. There was no cyanosis. No cool and clammy extremities, and
uh,
the
okay.
disability and exposure.
All right. Please tell me, so after your examination, what are your provisional and differential diagnosis?
So sixth post-op day after left hemicolectomy with tenderness in the left iliac fossa. My first differential diagnosis would be anastomotic leak.
Very good. Yes. And then
Next possible cause could be um,
Why is patient having pain to left shoulder tip?
that is
Could be
because of the
susceptible
diaphragmatic irritation of the.
and because of susceptible sepsis.
Yeah, so
Refer pain.
suspected sepsis is the second possible
Right.
cause.
Quickly tell me, how do you plan to manage this patient? This will be your last question. 5
So
minutes more.
I'll go for a repeat CT abdomen.
Oh, before that,
I'll go for
do
normal blood tests,
systematic.
CBP, ESR.
No,
Uh,
nil by mouth. You'll keep the patient nil by mouth, and then
I'll keep the patient nil by mouth.
you'll
I'll
send the blood. Yes, good.
yeah, reserve the blood and check for send for blood test, routine blood test like CBP, ESR, and probably do a CT abdomen, and if possible for emergency exploratory laparotomy
Oh,
or
that is at the end. This is
emergency surgery. I mean,
yes. This is at the end. First, you'll now once you're keeping the patient nil by mouth, you have to monitor the patient's input and output. So urinary catheter, then NG tube for suction and for bowel rest. Then you'll refer the patient to HDU. So there in HDU, you'll ask for the patient to get the central line inserted so that you could monitor the patient's fluid given crystalloid for resuscitation. Antibiotic you might give according to the trust guidelines. Then for the blood, you will send the full blood count, and also you want to rule out if there is sepsis or not. You'll also ask for ABGs and urea creatinine. Before doing the CT scan, you need to do the chest X-ray to rule
okay.
out any respiratory problem. Then you have to do CTPA because now patient is post-op, all right, maybe bedridden, and patient is has presented with shortness of breath. So to rule out pulmonary embolism. Then the quick and easy is the ultrasound abdomen that you can do to see if there is any abdominal collection. And then you can ask for CT scan because here by now you'll have urea creatinine and electrolytes results. So you can ask for CT with gastrographin enema to identify the leaking of the anastomosis, and then patient ultimately would need urgent laparotomy. Good, very
Yeah.
good.
Also, Dr. Vijay, in this station, it is written as abdominal examination, but it is not abdominal examination.
Yes,
It's a crisp examination.
Yeah.
yes,
Crisp,
yes,
direct.
yes,
And also,
direct.
don't forget, as I hear from Dr. Turkey, he said the file of the patient is near the patient. You should review include the abdominal examination. The file of the patient is near the patient bed, and you should see the vital. He is borderline hypotension, also tachycardia. Also, the oxygen saturation is maybe good, maybe oliguric. And you should, once you put your hand on the patient and he is severe pain everywhere in his abdomen, this is you should change your examination to crisp. Once he said to you, all my abdomen is painful, means it's peritonitis, means it's a crisp. I will change my examination to crisp protocol. So I want to review his chart. Then you said I will put a mask, 15 liter. His airway is patent. Breathing, I want the stethoscope. You should hear there is no pneumothorax, hemothorax, or obstruction is or secretion is
In the chest.
chest. I want to see his. Also, I want to take an ABG, CB, and in the C, I will insert one large port cannula and give him bolus of, because he is hypotensive, the patient in this station. I will give him bolus. I will take CBC, kidney function, electrolyte, creatinine, hemoglobin cross match, because this is a crisp protocol, and you will take the patient to the OR definitely. Then in the D, you will examine her in the D and exposure, you will ask the examiner to expose the wound if he have a wound or
Dressing.
the bag or dressing. And also don't forget in this station also, because there is those two stations for examination, but it's a crisp. This one and I think one is a
Pulmonary
BE.
embolism, yes.
You should examine the leg. You should examine. Tell the patient, do you have any pain in your calf? And squeeze the calf, because sometimes it is a BE.
Yeah.
The final diagnosis is BE. But this scenario, which presented today, is anastomotic technique, left hemicolectomy. By like this. Oh, sorry, the patient is in severe pain. I cannot proceed the examination. I want to review his chart. I will see just 1 minute, see his hypotensive like this, then start the crisp. I think I don't know, Dr. Samreen, is it I should review the file or proceed with the crisp, or after the crisp I should review the chart
You'll go for the crisp first, and then
first?
at the end you'll go for the review of the chart.
Review the chart.
Yeah.
Very fast. Say A, B, C, D, E. Then
Quickly,
I want
yes.
to, and then I will want to review, because the final thing you should review the chart. You should. This is one of the, even if it's appendicitis, or like this, you should review the chart, because you will see if he is febrile or not, is hypertensive or not, or like this. In abdominal examination, chart review examination also.
It's yes.
But
it's
in your mind,
included.
yeah.
It's important.